Welcome to my show, Musings from 20th Street. My name is Dr. Jane Goldberg. I am a psychoanalyst, and I am the author of, I'm sorry, I am the owner. I'm also an author, but I am the owner of La Casa de Spa. I'm the author of many books, including The Dark Side of Love, but that's not what I meant to say. We're here today to do the Really Real Reality group therapy show. And I'm actually extremely unhappy at this moment. I don't like the way the group has gone. The last session was very painful for me. I feel that the group is disrespectful to me. And if the group is disrespectful to me, it's disrespectful to itself. The group members are disrespectful to each other. And if you're disrespectful to other people, you're disrespectful to yourself. So I would really like to see this session proceed with people actually being interested in each other and being able to listen to each other and help each other to talk, as opposed to just throwing out barbs at each other. And I'd really like the group to allow me to do my job as a group leader instead of my having to yell over them to be able to do what it is that I was trained to do, which is be a psychoanalyst in group analysis. So with that group, I don't know. Can we do better than what we've done? Because I'm pretty unhappy.
Yeah, I think we can do better.
Yeah, we can do better. Sorry, Jane. I really don't like you to be unhappy. You're such a happy, wonderful person, and I'm sorry if I contributed to that in any way.
Well, in the last session, when you mocked Barbara and I said you can do better, and you said, no, I can't. What was going on for you that you could? I know you can do better.
I just didn't want to get past it. Yeah, absolutely. It was just that initial, the stone, you have to roll it away. So I was rolling my stone away.
So I welcome you to put any negative feelings toward anyone in the room into words.
No, I have no negative.
Well, as the session proceeds,
Oh, okay.
I'm sure something will come up.
Okay.
Okay, well, being silent is not cooperating with me either.
I'm
afraid
with
to
the
say anything
messiness
here.
some, but I'm craving also more communication with people. Certainly, I did have some at the end of the last one with Suzanne and with you. And I've had some communication with Shanti.
Was it helpful?
That's just,
Sorry, I didn't mean to interrupt.
it gave me a little. Yeah, I guess I was repeating what I said at the end of last session, that I hadn't had enough communication. Then it looks like I needed at this moment to go back to that space and then to realize that, yes, I did have some that gave me something, but I don't see that it's possible for all of us to really have a lot of very satisfying communication in one session, because it's just too short a time, 27 minutes, or even 3. Well, maybe 3, there can be something more, something closer to satisfaction, but
You
still
can
too
have
difficult.
you can have satisfaction in an instant. It doesn't take 27 minutes and it doesn't take 3 hours. It takes an instant.
How about 27 sessions? Because it doesn't seem to be working. It really doesn't.
That statement really needs qualification, Jane.
Walter.
Walter's a beautiful name. I love the name Walter. My grandfather's name is Walter. I bet you it's a biblical name, I bet you, but it doesn't seem like it would be.
Group.
You know
Okay.
what it is, what it means?
Okay, Suzanne, Walter,
Strong
Walter,
warrior.
let me do my job. Suzanne, that was an interesting communication.
Thank you.
And I think it arose out of some feeling that you were having toward Walter. And if I were to guess, I would say you were having a positive feeling at that moment toward Walter. Is that correct?
Yes,
Okay, just checking that out.
I wanted to help Walter.
You wanted to help him.
I didn't want Walter to be in pain. He went to the bathroom and he might have got stuck in the mirror, and I was concerned about his well-being. And I wanted him to feel good about himself.
Oh,
Because beauty's on the inside.
I always get stuck in the mirror some. I am a narcissistic personality. I really
That's
want
not
to
your fault.
I'm surprised.
It's society. It's a communal problem. It's not an individual problem.
I'm
some truth
surprised.
to
Wait
that.
a minute. I just want to
I wanna
say
respond
one
to
thing
something
the
you
group,
said.
Walter, real quick. I'm surprised that Dr. Goldberg sat there very emotionally and said that we had disappointed her, and that I felt obligated to address that feeling and apologize, and if I contributed in any way to try and improve it, and nobody else. You just went on to your own crap.
I did. Remember the first thing I said to Jane was?
You know, I think that's very shows a lack of this kind of lack of sensitivity that maybe she's referring to.
I did. I addressed it the first thing.
I didn't hear you.
I said, I'm okay with the mess.
No. What about her feelings? We hurt somebody who's been trying to help us here for 40 sessions. Can't we just say, I'm sorry? Don't you feel obligated to do that? Right, wrong, or indifferent? Why would you want to contribute to that? Well, not you, but everybody else too.
I don't know about
I don't know.
Please
That's
let Carol speak.
too large a question that needs too large an answer for me right now.
Okay, somebody's in pain. It happens to be our therapist. She's expressed that we have all, in some way or another,
right.
have had contributed her to that feeling of pain. Now, I
She
think
assumes
we
too
should
much.
all address that.
She assumes too much.
Her pain is not relevant to what she assumes.
She assumes
or
too
she is
much
right
to
or
put
she is
herself
wrong.
in that position. I do have difficulties, differences
So
with
she can feel for your pain, but you
psychoanalysis.
can't feel for hers.
And I also noticed that last week, I'm pretty sure it was last week, Jane, you were different in the way you dealt with having to wait a few seconds for someone to finish a statement and then paying your attention without making you wait a long, long time. You were much easier with it. You were patient. This week, you are less patient, and it makes me think that, well, you're very human too, and you have other things maybe that go on with you that make you feel more demanding, that you need. That's one thing.
I'll tell you what I aspire to be. Different every moment. Because I aspire to be responsive to whatever it is that's happening in the moment.
Mm-hmm.
So I'm sure I'm different now than I was last week.
Yeah.
And I'm sure I'm different this moment than I was 3
Right.
moments ago.
Well, I don't like this week too much as
I don't
compared
either.
to last week. I
I
just
don't think anybody's responding to anybody's pain in here. I think everybody's
feel
been
you're being
attacked
demanding.
here and still being attacked.
Oh, Barbara, I invite you, respond to my pain.
Well, I think you're feeling what
That's
we're
right.
all feeling,
We
but
gotta
I
have
think
some of those
everybody is being attacked in here. And Suzanne just made an attack. I just
what you
observed
mean.
another attack to. Because you also looked.
Okay, so I'll tell you, I really liked what Kay said, and I'm going to tell you why. I liked what she said because she assumed responsibility, whether she's really responsible or not. She put herself in the position of assuming responsibility for.
Absolutely, because I don't want you to feel that way, and like I said, we'll work on not helping whatever I'm doing stop to not make you feel that way.
So why I like that is because you have created a relationship between us.
Right.
You said you're part of what's happening between us. Even if you're not, you've allowed yourself to entertain that idea and position yourself in that way so that we could
And that's
dance with that.
Well, I apologize to you, but I feel like I have to apologize to everybody for everything I say. So I got to, and Carol had a point. And Carol understands me better than anybody in this group, including the therapist, because she says, yes, Barbara does talk a lot. Yes, Barbara has her reasons, and nobody really knows my background, really. And why there is a reason
See,
behind all that.
I want something from you. I want you to say something that pertains to me as opposed to pertaining to you. We do know that about you, and except for maybe Suzanne, who just met you,
Right.
we do. Everyone in this room accepts that about you, but that doesn't mean that we're satisfied with it.
Well, I'm not satisfied with it
I'm
either. I'd
shocked,
be the
Jane.
first
I
to-
am absolutely shocked by the cement wall here, by every single person who's been in this group more than Suzanne, not saying to
And
you,
you've never had
I'm
a
sorry,
cement wall?
you're in pain. Not Carol, not John,
We're all-
none of you.
we're all-
I am shocked.
We're all acting better because
Not
Jane
you, Suzanne.
asked us.
Not
No,
you.
me
No,
too.
but everybody who has been with
There-
Jane and has learned had a grain of wisdom, or do you not? Why is
Because
no one
we're-
responding to the fact this person is in pain, and that you and you
Because
and
we
you
don't
and you
have
and
the
you
skill
and
set.
me might have
No,
contributed
Thank
to
you.
it.
That's
Well,
not
that's
true.
the best thing you've said.
That's not.
Ted.
I feel like I have a
address
pretty
this.
good life skill set. I didn't stop the group and say what you did, although I was glad you said it, and I thought that it was nice that Jane heard it out loud from one of us. I feel that way. I'm crazy about you, and I like to please you. I don't want to disappoint you in any way ever. But
Guess what,
I-
Carol? I got news for you.
what?
You have never disappointed me.
Well, thank you.
God, and
I'm glad to
Jesus
hear it.
Christ on
Here's
the
the-
cross being
But
crucified.
what if we all responded just like you did?
No, not like me. Just in
Well,
your own way, whatever
okay,
your way
my
was.
own way was to make sure I didn't interrupt and to try to keep Barbara to just be still and not talk so much, and it doesn't work. I've asked you 7 or 8 times this session, and you said that Dee and Carol can keep you, and I can't. Dee can, I can't. And the point is, you felt bad, and I felt like if we just be quiet, let you lead the group, that would please you. So that was my way of supporting you.
Me too.
Yeah, it's not that I don't care if you're in
But
pain.
don't you
I
think
do.
she would want to hear it too,
She
Carol?
did hear it, but I didn't feel like I could there wasn't like a poignant moment yet where I could take the floor. And now I have.
Well, now
and
you
I,
have it.
Well, and I've said, I said what I wanted to say. It wasn't exactly what
No,
you said.
no, it shouldn't be.
But, I think that we have an understanding and that I'm sincerely concerned about your feeling satisfied and like you're doing something positive and you're good at it and we all respect you. I do respect you, and I think everyone in here does. I don't know, but I assume they do.
I wanna-
But that's not what I thought you really needed from us. I thought you
I
needed
need-
cooperation.
I need exactly
First
what
and
you're
foremost.
what you're giving me right now. And I want to clarify something. I want to clarify why I said to Carol specifically, "You've never disappointed me," because Barbara
I
had
have apparently every day.
because Barbara had a very negative reaction to that. As the psychoanalyst that I am, with the specific training that I've had, what I work with is induced feelings. So the induced feelings, what it is that I'm feeling in relation to everyone in the room, tells me something about the character of the person. It tells me something about who you are. It's very important to me. It's nice having positive feelings toward Carol, but that's not the issue. The issue is that my having positive feelings for you and this sense that you've never disappointed me, that you want to please me, and that you want to please me, and that, in the last session when you said, no, you can't do any better, I know, I know your basic heart is that you want to please me. And it's not that, it's just nice that I have great feelings about you. It's that it says something about who you are. And it's important that I serve as a mirror to you in putting my induced feelings into words, that I'm holding up a mirror to you so you can see yourself. And it is true, Barbara, that you don't stimulate in me a lot of positive feeling because you work at
Want me
odds.
to leave now? I can leave
I don't
now.
want you to leave. No, you said that in the
love
past.
it.
No, that's
Oh, I know
absolutely.
you would.
Yes.
Barbara, I'm going to tell you what I want from you. I want you to cooperate
happy
with
as a
me,
clown.
Barbara. See, that's not cooperating with me.
Well, no, but
that's
you
not
know
put-
what? She loved me to leave
Okay,
so
but-
she could take over the group.
But Barbara,
Yes, I'm going to take it over.
Barbara, I'm talking to you. Why are you paying attention to Kay when I am talking? That makes me feel
Because
that
she
you're.
just interjected.
But Barbara, if you value our relationship, when I'm talking to you, you don't go off to, Siberia. You stay with me. That would give me a positive feeling about you, that we actually are in a relationship, that we're doing something together. I'd like to be able to do something together with you.
I just don't think I'm good in group therapy. I've never been good
No,
in
it
groups.
doesn't.
I
It's
really
not.
haven't.
Barbara, right now it's you and me. This is not group. This is you and me, 2 people together. Can we do that? Can you stay with me?
I'm trying
Great.
as best as I can. and
Great.
It's not easy.
Okay, how does it feel to you, what I've said to you? That I would like to be in a relationship with you, and I'd like to do a dance with you where sometimes we pay attention to me, and sometimes we pay attention to you. And that it's not always about coming back to Barbara, that sometimes I do want Barbara to be able to say to me something like what Carol and Kay said, that Barbara could say something to me about, wow, I didn't know that about you, Jane, or wow,
There we go again.
and there you go again.
But I wish you would show
There you go.
Stop.
But Barbara, why? Why can't you just stay with me?
Because I
Please,
bothers me.
stop
Feel
swearing.
like I hear a
Can we
mosquito in my ear,
try
and
to
as
do
I'm trying
away
to
with
talk
the
to
swear
you,
words?
it's like Lana when she came in the middle of a session. You know, I can't have my attention
Yeah.
with here and here.
Yeah.
You know what I'm saying?
Yeah,
I
I
have
know.
2 ears. but
So
they
I
only hear
so
one
I
thing.
want you to put your attention here.
Do you just look like you're about to cry, or do you feel that way?
I feel like there's so much hatred in this room that it brings me back to my childhood where everybody argued and threatened each other, and people who think they're perfect, who have more issues than other people in the room, and really ought to look at themselves in the mirror. Because I'll be the first person here who will say, I'm this, I'm that. I know my faults. I don't
Okay.
need a therapist.
Okay,
to tell me.
Barbara, I'm taking my right to be group therapy
What's
now.
happened?
Group therapist.
What happened?
I would just want to go back to the point of how the Dr. Goldberg was feeling and how we're going to deal with that.
Well, the doctor seems to have been shifting
How
from
did
her.
you feel about that?
How did
when
I
she
feel
said
about
that?
what she said? Well,
Yeah.
I don't feel I'm responsible for the doctor's feelings.
Of
That's
course
no,
we-
but I can have compassion nonetheless. But I don't hold myself
Are
responsible.
you sad that she would feel bad? Why aren't you more empathetic?
Whoa,
Oh.
whoa!
Yeah.
Your assumption that I am not empathic because of what I said really rocks me a bit. So
Sorry.
that's no, I don't. No, cool.
mean to
I
say
want
that
you to
you're
be a.
It
No,
sounded that.
no.
Well, I just want to. I want to hear you say, and I'm sorry.
I
I want to hear Shanti say, Dr. Goldberg, I love you. I don't want you to feel bad. Let's fix this.
Okay,
Why?
Dr.
I
Goldberg.
want everybody to say that. Could you say that for me?
Repeat that again. I wanna-
Dr. Goldberg, I love you. I don't want you to feel bad. Let's fix this.
Dr. Goldberg,
And you're doing it because she told you to do it, right?
why not? It's a reasonable request. I think it's a damn good request, and I'm honoring the request.
But
if
why
you'll
can you
allow
do it
me.
on your own without her telling you that, though?
Do you really get the impression that I wouldn't be able to function autonomously?
No, I do think you can, but it sounds like you're listening to her on her.
It may
Go.
sound like that, and you may be very right.
She's lucky
In
she has an
fact-
in.
In fact, I am listening to her, and I feel good about listening to her because she's asking for something that's very reasonable. She's asking for an overt manifestation of compassion.
But you looked angry after she said
I
that.
did.
Yeah, you said,
Beauty,
oh. you went like
beauty,
that.
my dear, is in the eyes of the beholder.
Well, you reacted to her, though. You did.
I did,
We
and
all
I
wanna
thanked
say
her.
that.
And
Let's
I
just say
thanked
it. I've
her.
got to
Let's
let
just say
you
we
say
all
it.
feel that way. We all feel that
She's
way.
stopping.
Doctor-
Shanti, don't let her stop you from saying that. Just
You're
please.
so right. Thank
Just
you.
she wants
Thank
to block
I
you.
needed
She
that.
wants to block that from the doctor. Please give it to her.
Of course she knows
Please.
everything.
Dr. Jane, I'm really sorry that I couldn't have contributed more to preventing all of this from happening. If I could have waved my magic wand as I wish I had and could say to you, please, let's be more compassionate towards our beloved teacher here, who's trying to not just get a project going, but to try to teach us to hear with one another, not just from our ears, but from our heart, because this woman is loaded with compassion. And she may have an abrasive manner for you, and she may have a loving, divine one for you, but she really has a heart for all of us. Otherwise, she wouldn't be here taking all this.
Oh, Shanti, thank you. That was so beautiful. That's what I want to hear.
And
Now,
I do
want to hear
think
you.
about her over the week, and I say, this is a
I
rough
want
job.
to hear you.
What if I were
Well,
John's next. I want to hear John.
Well,
John, say something.
I do feel bad when I see you struggling. I feel bad. You know, I feel sorrow for you because I do see you putting a lot of effort into this. You don't have to be here. You don't get paid for it, and we're not getting paid for it here, but we do want to be here with you because that's why we're here, and that's why we keep coming back. But I do feel a little bad when you're frustrated, and I see that you're, and not to pick on Barbara, but I do see that there's a lot of attention. You give her a lot of attention because there's
She
something,
demands
the relationship between you two. And
not
sometimes I feel
loving.
really bad when I see you struggling, trying to control the group, and try and move forward.
Okay, Walter, you're next. This is good. I love this. This is the best thing.
I feel angry.
Aren't you good?
I feel angry at you.
Hey, John, it was
I
beautiful.
feel
That was really beautiful.
you're setting up a whole.
No, we're
No,
not
he has a
doing that.
right. He has a
I
right.
feel I
He has
believe.
a right.
No, okay,
You can't write a
Oh,
script.
but we're on such a
You
good
can't-
roll.
No,
now.
no, no.
We're not.
I want to tell you that I welcome Walter's anger as much as I welcome your
really wanna
and
hear what he
John's
has to say.
and Shanti's gratitude.
And Carl. Okay.
I'm so confused.
I welcome all feelings.
I'm so confused.
I just want the feelings put into words
Carry on,
instead
Mike.
of acting out toward me, toward each other in abusive ways. Y'all are abusive
Well,
to
that
each
happens
other.
to be one of the things I like now that you have helped seriously bring about here. That's brought me to some feelings and brought Barbara to some good
What
things.
did I hope I didn't bring about abuse.
Yeah, abuse is
yeah,
not
one
good,
of
Walter.
what did you say about just now about feelings about helping
I'm
people
perfectly
express
happy.
feelings in words to each other?
I'm perfectly
I like
happy
that
to
about you.
stimulate negative feelings.
But what I
I'm
was,
just not happy to stimulate negative behavior.
what I was saying is that what I feel is coming from you this week makes me angry because I feel like you're doing something that is presumptuously setting up an arrangement here where you're putting yourself in a position that demands something which denies people.
I understand.
I'm not troubled with the mess. I would use the mess. The mess that you've talked about, which is what you didn't use a word for, what was going on in the first. I would do it differently, and I don't. I just feel like about that much what you said. Like I feel like saying, whoa, no.
Okay,
no.
Barbara,
What?
That's
if
my
I were in
honest
a-
feeling. Talk to me more about it if you want. I'll listen now.
if I were in a non-narcissistic state, what I would say to Walter is, I do see that you're more comfortable with messes than I am. I would just accept where he is as opposed to saying, oh, Walter, you're full of shit. I mean, this is ridiculous. Wait, you're so wrong, and why are you even talking? And I wouldn't.
So, in other words, being
No, we had
non-judgmental.
a nice flow going here.
Non-judgmental.
That's the
Being
key.
neutral.
That's
Being
not
neutral.
neutral, just non-judgmental. Being able to say, I can see the other person's point of view, even when I don't agree with it. Even when
right, I agree
and
with
allow
you.
for, and allowing for it. Allowing for
But
it.
has that happened here? We've had a lot of judgments
When
here.
you've made efforts, and I have seen you make efforts, damn it, I really have.
thank you.
And,
I appreciate
I'm
the
sure you
positive
do. I'm sure
response.
you, and I know how difficult it is for you. Apples don't fall far from trees, or the other way of looking at it is, there's nothing anyone here is that I haven't been or am.
No, I
Think about
appreciate the positive
Think
reinforcement
about it.
because you get,
So-
what is it, you get more flies with honey?
I'm waiting for her to pull out her switch.
Jane, I'd like to know. If
Okay,
you have
if
a
I were in
response
a
to me.
non-narcissistic state, what I would say to Shanti is not, I appreciate what you're giving to me. I would say something in relation to who she is. I'd say, Shanti, you're so wise and you're so articulate and you're so fabulous, and I really love having you here. That's what I would do if I were in a non-narcissistic
Being
state.
complimentary.
No,
If you were-
it has nothing to do with being complimentary.
Just like I would
I,
with you.
I would be saying
No, I was
what
being
I would be saying what I'm feeling toward her, which sometimes is positive and sometimes might not be positive. That moment, I was feeling very positively toward her. So I would be.
I would say there's something wrong with you if you didn't feel that way.
But isn't positive
definitely
reinforcement more
something wrong with
important than, because you get more flies with honey? You really do. If you want people to behave
No.
a certain way,
No,
it's like
you-
the pack of
no.
dogs theory. You know what I mean?
No, Barbara. Okay, you asked a question. I want to answer it. No.
Well, so much for
The-
my therapy that I've been going into.
No, the
anyway.
response
Someone's
should
gotta set
be
limits for you.
the punishment fits the crime. The response should be appropriate to what it is that's coming your way. If it deserves a negative response, it should get a negative response.
Oh, I'm out
but
of
be
control,
conscious-
but I have an
but
out of
be-
control life, so I think I am my
But be
environment. My
conscious.
environment is
But be
me.
conscious how often your responses are weighted. Are they? Are we really giving forth a lot of negatives, or are we really looking for the sunny side of situations?
right.
We have a choice. Every
Walter, can you
comment we
stop
make.
fiddling with that paper, please, for a moment?
Stop playing with your toys.
Deal with your feelings.
Sorry.
Why,
I
we
couldn't
can't
hear
change
you.
the
Don't pay
world.
attention to
we
it.
can't. We can only change ourselves.
Well,
I like to try the world
I
too,
know,
though, Shanti. I want to give it a shot.
I know. You're the old college try, girl.
Oh, I do.
Now, if I were in a non-narcissistic state, what I might have said to Walter when he was piddling with his paper was
Right.
instead of trying to control him, which is just,
Stop.
coming from my own issue, I might say, Walter, I see you fiddling with your paper. What's going on for you? Could you put that into words?
That's great. You see?
Except it would take a little long. I wanted to hear what she had to say and have him stop it while I was
So I
focused.
might tack on, Walter, I'm
And he's
trying
still
to
doing it.
I'm trying to listen to Shanti, and I'm finding what you're doing distracting. And so,
Right. Absolutely.
if you could do that for me, it would be really lovely.
It's called
Absolutely.
grace.
Right.
Grace. A little grace.
Right.
Or tact.
God,
What
I'm so
tact?
confused.
Yeah, having some
Josh,
tact.
what do you want to say?
Yeah, I appreciate the fact that you want to handle negative feelings, but you are really disapprove of negative behavior.
Exactly the
because
point,
That's
Josh.
exactly what we're struggling with
Yes.
day in and day out
Absolutely.
in this world. I mean,
Absolutely.
I don't mind a Palestinian telling me he hates me, but when he starts lacing himself with dynamite, I'm terrified.
Right.
Yeah,
Blame the Arabs.
very good, Josh.
Yeah, that's
Yeah,
not good.
great
Blame
Josh,
the
bad,
Arabs.
bad.
Walter,
bad.
watching television.
Blame the
Walter,
Arabs.
would you please? I'm having trouble hearing them on this side of the room because you're squishing the paper in your jacket.
Well, I
Would
did
it
it
be
once more a
okay-
little to
would
try
it
to
be
get it in
okay with
position
you?
so that I wouldn't have to squish it anymore.
Would it be okay with you?
My
if
hands
you
are
would
cold.
stop
I
it?
want to keep them
Okay, Kay, it's a slight.
Off at this paper.
It's a slightly more polite way of trying to control it.
exaggerated polite,
But
right?
but it still doesn't get at what's going on for him. The way you change
for you.
behavior is by helping people to
yeah, but Jane,
is by helping people to understand what's going on for them.
Absolutely agree, but that's not child behavior. And when child misbehaves, you tell a child no. You don't sit and explain it away.
But you don't do it with an
you don't
adult.
have
What you would do
children.
with a child, then you had to
But
handle
he's
it a little
acting like a
differently.
child.
Don't-
He's filling
although
the
I
paper
think
like
the
a
children-
3-year-old.
I do
although
have
I
a
do think
response
the
to you.
children, I do think the children should be handled differently. Also, in
And
other
some
words,
adults
grace.
are indeed children. We all have a child in us, and we all act childlike at times.
But when I'm annoyed, that happens occasionally.
I feel like Jesus
I
is going to come
try.
into
I
the
try
room
to
and judge
use.
everybody.
I try to allow me to bring the best out in me. I really mean that. I think all of us
Right.
are each other's teachers, and we should
Yeah,
be
that's
thanking
true.
each other for the opportunity to practice
Right, absolutely.
self-improvement, if
But
you
it's
will.
World War
Amen.
III.
Shanti,
That is
I want to
very,
say
very
that you're
well
not
said.
going to have
True.
you're not going to have had a complete therapeutic experience until you are annoyed in this room with us. Thank you,
Keep
group.
working on it, kids.
Thank you.
Yeah, we
I
Thank
do
you.
have a
Show
response to you.
Doing
Okay, well,
better
Save it
this
for the next
session.
show.
I'll try.
Just write it down.
Kids
You
are
can add
gonna have
another
time. We're
48 weeks
practically
to
over.
this, or what?
I forgot it now.